In this recording, the following clinical skill will be demonstrated. Equipment for this drug administration has been pre-prepared using aseptic non-touch technique. Before administering a medication, remember the 10 rights of medication management. Introduce yourself to the patient, explain and discuss the procedure with them, and gain their consent. Ask the patient if they would like a chaperone to be present during the procedure, and check if the patient has any allergies. Follow the 10 rights of medication management to reduce the risk of medication errors. Carry out hand hygiene. Risk assess for the necessity of wearing personal protective equipment. Maintain the patient's dignity and respect by closing the curtains for the procedure. The area around the umbilicus is a site for a subcutaneous injection. Check the site for signs of edema, infection, or skin lesions. If any of these are evident, select an alternative site. Avoid injecting within a 2-inch radius around the umbilicus. When administering a subcutaneous injection, a 45 or 90-degree angle may be used. Patients who are cachectic and therefore have minimal amounts of subcutaneous tissue may require injections to be delivered at a 45-degree angle. Having positioned the patient comfortably, inform the patient you are about to carry out the injection using distraction or relaxation techniques if necessary. Hold the syringe and needle in your dominant hand and pinch the skin together using the non-dominant hand to lift the tissue away from the underlying muscle. Insert the needle at the required angle using a dart-like action. Depress the plunger and inject the drug slowly. Wait 10 seconds before withdrawing the needle. This will prevent backtracking of the drug. Do not massage the area, as this can lead to bruising following administration of heparin, and it can also speed up absorption times with insulin. Release the lifted skin fold. Dispose of sharps directly into the sharps bin according to local policy. Carry out hand hygiene. Monitor the patient for any effects of the prescribed medicine and any problems with the injection site.